Welcome everyone. It's a pleasure to have one more allergy legend with us. And in this allergy legend series, we are having interviews with our allergy legends of our country. From their life journey, from their experiences, we are trying to learn many things. And today we have none other than Dr. Nagendra Prasad sir from Bangalore. Sir needs no introduction. We know him. He runs his Bangalore Allergy Center, and he is not only an academician, a clinician, but he is teacher of teachers in the field of allergy. So I welcome you on behalf of IIP Allergy Chapter, Nagendra Prasad sir. It's an honor to have you with us on Allergy Legends.
Thank you very much, sir. Thanks to Dr. Vikram Patra and IAP Allergy chapter giving me the opportunity to share a few vital points in the field of allergy with my experiences, whatever I had.
Yes, sir.
And
So to start with, can you briefly tell us how you describe yourself and not just as a doctor, but as a person?
sir, to start with, I am genetically influenced with a background of business, sir. So all my family members are business people, and I born and brought up at Mysore, and I was in the Shirampet near to the medical college, and I was living with maternal grandparents, and my parents are in Chintamani, which is close to the Bangalore. We were a joint family having 6 brothers and 2 sisters, and I was aspiring for a business and motivated to set up an industry, and which did not materialize because of the joint family. So I had only chance to go for the studies, either engineering or medicine. There is only 2 options what we had. So I opted for a medicine, and I procured a seat at Mysore Medical College itself, and it was very tough in competence in getting a seat. And this is the oldest college in the Karnataka, and we celebrated centenary of the Mysore Medical College last year. And Dr. P.K. Vedantam is also a same college, but he was little senior to me. And I was posted at a casualty as a houseman, and I used to get a asthmatic patients on a clockwise. A patient who comes at 7 o'clock in the evening is every day he comes at the same time. And some people used to come at 11 o'clock. Some people used to come at midnight. And I used to give him only the aminophylline, sometimes adrenaline. And I was really pathetic. Every day they had to come and rejuvenate with these drugs like aminophylline and adrenaline. And they used to become all right, comfortable for 24 hours. But I was really pity on those people. Why can't we give some alternative measures? But I was not able to go beyond bronchodilators, antihistamines, corticosteroids, and they're all dependent on most of the corticosteroids in the oral form or injectable forms. And I was really concerned about the event. And
so your concern from right from your college days, we can
yes,
see. So
yes.
if I'm not wrong, so your experience must be more than 4 decades or 5 decades into the field of allergy.
Yes, sir.
Yes, and
Yes,
what keeps
almost
you
near to the 5 decades now.
yes, sir. So what keeps you passionate about it even today?
Even today, after entering to the allergy, which was fascinated because if you go to the other specialties or the other branches, there's a constant stability of treatment will be there for a long time, and no fascination is there, and no pulsating information will be there. But after coming to the allergy, I see every alternate days or some information, new publications will be there, new application is there, and there is a lot of ongoing allergy which is happening in this field, which is really very interesting and impressive. And also we'll be fascinated to implement. Why can't we implement and why can't we see with our new patients? So new molecules are coming in the form of inhalers, and new molecules are coming, new biologicals are coming, and we are also improving allergen immunotherapy in a little better fashion. So I think this is more fascinating, but only thing, acceptance by the enlarged professional colleagues and patients is still not very friendly. And
Fascinating, sir.
so because this treatment has to be continued for a long time, so
Yeah,
we want to reduce the schedules so that it may be more attractive.
fascinating, sir. So you must have started your journey as a pulmonologist, right?
As
As a
yeah,
pulmonologist.
no, in fact the pulmonology which has been intervened in between, and then we continued, and I know I am basically on the allergy practice,
Yes, sir. To
and
start with,
I
you started as a pulmonologist.
yes,
What was your first exposure to allergy? You mentioned that key patients getting again and again the similar symptoms in the night, early morning. So, can you recall a moment or a mentor who influenced your choice to specialize in the field of allergy and to leave pulmonology?
after the course is over, I came to Bangalore for make my final decision what I should make it, and I stayed for a few weeks with my brother's house, and one of the IMA lectures was there, and I saw that Dr. D.N. Shivpuri came from Delhi and speaking about the allergies. I was also a little fascinated, and then I thought, why can't we have a participation in this lecture? And I went to the lecture, and it was really very interesting. Though there are some clinical manifestations are limited, but still he is giving impressive thought that this is going to be the major impact in the field of allergy disorders, and definitely uh, we can implement a good application to the therapeutic mode for greater relief to the patients. That was the impression which I got it. And after the lecture, I discussed with him in a person, and he assured that definitely it is a very good branch. You should take it up. It is more of R&D, academic activities will be more, and you'll definitely will enjoy. That's what he said. And also, he said the quality of life will be improved to these patients, which we are limited with a few molecules in the pharmacy.
Yes, sir. So means now we know that there are many training programs running in our country for training in allergy, but 4 decades back, so there were very limited thing. So how did you navigate that period
Only
in training?
we had a source only with a DN Shipuri. That's what I learned. And I browsed, and it was time the browsing was not there. And I communicated with a couple of friends and through the phone, and I talked to them. And only D. Shirpuri was the ideal man. And he is the man who's brought the technology from the West to the Delhi, and he implemented in his institute and he started it. He is the first man to introduce this specialty in the field of medicine. So I had to depend on him. I said, I want to spend some time with you. And he invited me, why can't you start working in the OPD for some time? And definitely I was interested, and I spent a few weeks, couple of months also. And it was fascinated, and definitely I thought, why can't we start this program? Before that, I searched some informations in what we had in Bangalore, and some few physicians have made some urology study, and they have surveyed the type of pollens what is found in Bangalore and which is likely to cause this allergy. That was the only basic information which I had. So after motivation from the Shivpuri, then then I thought we will start with this program. So I came back and I initiated, and I told him that I am starting this program. I need your guidelines. He promised me definitely I will give the guidelines. And he only suggested that your name of the clinic should be Bangalore Allergy Center. because anything which is come out of this particular work, so he should be referred as Bangalore Allergy Center. So that will be much more interesting and impressive. That's what he said. And luckily, one program was there in Mysore, CFTRI, conducted by Dr. Ramlingam. He was working on molds, and he called the Dr. Pepis to participate in this workshop. And all the way, Pepis also came, and Shivpuri also came for the same meeting. So both were staying at Indian House of Science guest house, and I requested Shivpuri, why can't you inaugurate this clinic? And though I didn't had any infrastructure, I didn't had any thought of it, because it was 2 days. So just I put my table and then inaugurated the clinic and
Great, sir.
called few people.
Interesting journey, sir. And
Yes,
having the name of Bangalore Allergy Center, and we know what that name means now. Sir,
yes.
what were the early challenges you faced when you decided to start on allergy field and advocating allergy care in our country? What were the early challenges you faced?
Yeah. The challenges for me is understanding the subject and application of the allergens, which is not known to me. Of course, I studied about botany and I know about the technical names of the plants, how it is derived and all. And I took some time to understand about these pollens, how these pollens are released and how it is affecting to the uh, individuals who are sensitive and subjective for allergy disorders. And over a period of time, I think in the beginning, to see the patient was really very tough time. And I started learning one by one. And even some of my friends taught me, you have to take care of this, you have to see this and that. So many things, clinical science, they were taught me. And I first 3 months really had a tough time. I was little nervous in treating the patient. I was most of the patients at that time were referred by the colleagues who are resistant to the steroid, not responding to the drugs, and they were sending. And I was not knowing whether that V's has to be treated with allergen immunotherapy or not. So simply we were doing the allergy test by intradermal. Intradermal was the preferred at that time. Skin prick test was not known. It was known, but they said that intradermal is more preferable than the skin prick test. So we were having number of tuberculin syringes, maybe about 100 to 150. Out of 150, we were doing about 60 to 70 allergens, selective allergens we were testing. And we had a series of vasovagal attacks, and a patient used to collapse while sitting. And only one patient had a severe anaphylaxis. That is because of the Parthium sensitive. She was very severe to the Parthenium sensitive. And we could revive it immediately by giving the adrenaline. So that is how our journey started with, it was not a smooth journey. It was walking on the needles. So really a tough time.
It was good to know that many friends supported you during the initial period. But now also we see many they don't believe in the treatment of immunotherapy. So long back that time, definitely you must have experienced many resistance from our colleagues themselves about immunotherapy, and they must be skeptical about immunotherapy treatment.
Exactly. They were telling it's a placebo therapy. It's only experimental, and it may not be as successful. And only they felt it that every therapy fails, then only immunotherapy has to be taken. And some of the doctors was misled that you are giving some serum therapy. That we were telling it's not a serum therapy. We are giving the biologicals and extracting from the aeroallergens, and then we are giving this. So that was a message was going on, and a quarrel was also there. And they were advising me to go with a normal practice, don't go for this practice and all. They started discouraging. And of course, I had a tough time with the family also. And I was entirely depending on the practice, and I had to take care of the family also. So I told one day to my wife, this is the scenario. You suggest me to have this challenging field, or should I go back to the normal practice and having a luxury packet? Then she thought few minutes, then she said, yes, this is a time we had to go for a challenge. Why can't we do it?
Yes.
So she supported me, and that has motivated me. And I said, there's a lot of learning process are going on in this field, and why can't we adhere to this? And we'll see. In the meantime, we had a couple of research activities were going on in Bangalore. One is at Indian University of Science, Parthenium allergen was taken care of by Dr. P.V. Subrao. He was a biochemist, and he was doing a lot of work on that. And one Dr. Krishna Rao and Dr. Channabaswana, he was a entomologist in the GKVK, Agriculture University. They were doing work on the mites, and they were growing, culturing and all. And Dr. Dr. Agashe, Professor of Agashe is the head of the Department of Botany, and he was initiated on the aerobiology work. He was a paleontologist. So he initiated the work after my clinic has started. And these are all group of people which we could interact, and then we learned more and more and started implementing.
That's great, sir. I must thanks Madam, because of her and because of her motivation, we got a good teacher in the field of allergy. Uh, so now we have seen, not me, you have seen allergy field evolving in our country in last 4 5 decades. So
Yeah.
how has public and professional awareness of allergic diseases changed over this period?
Uh, Only the changes which I have seen from from 2000 onwards. Before the 2000 onwards, really we had a tough time. But only I used to get a lot of support, moral support, when I go to the conferences, national conference, international conference, and that has motivated me. And you see, EACI Congress, they used to have only 8,000 to 9,000 participants. Now we are getting more than 25, 30,000. Really, it was fascinating. And after seeing all these activities, then I thought I should continue with this. And we had one international aerobiology conference at Bangalore. And one Franklin from London, he came here and he was stayed. And I was asking him also, do you feel that allergy field will be growing more, or it will be stagnant like this, what I said? No, he was very confident. And he was the first man to give a subcutaneous immunotherapy with a double-blind placebo control study. And and he said, really, he has got a better future. You should not discontinue, you have to continue. So that has, like this, a motivation started from different people. And that's how I adhere to this branch, whatever it may be, whether I get a good profit or no profit, at least I am in the right field, I should continue. As a private practitioner, I had to work academically, and also I had to get some money to spend for a family to run. There's a two factors.
Yes. Definitely, sir. And that is the reason why we have come with this allergy legend. So, as you mentioned, you got motivation from many friends, many people. So, we are getting motivated by legends like you. Now, sir, we are seeing that a lot of changes are taking place in diagnostics, immunotherapy, and preventive care. And we all know the innovations in the field of immunotherapy. You are the pioneer in one of them. So you have decided to go little beyond the conventional drops of sublingual immunotherapy, what we use, what subcutaneous immunotherapy we use. You are the first person to launch sublingual immunotherapy tablets, and before that, sublingual immunotherapy the films were there, strips were there. So how about that journey, sir? We would like to hear from you.
Uh, Way back in 2006, I think. You see, we heard about the sublingual immunotherapy, but we are not able to do it because we could not get the technology. And also, there was no need because subcutaneous immunotherapy was continuing, and people were getting response, and they said, I am very comfortable, I am likely to continue. Nobody has complained about this kit except a few dropouts. And later, one particular subject who was working in the IT, and he came for me with allergic rhinitis, very severe. He could not able to work on the table, and he was getting very severe. Then as routinely, we did the routine test, and then we found that he is allergic to the parthium. It was a very, very big reaction. It was more than 20 millimeters of reaction. And then I said, you are very severely reacting to the parthenium and you have to subject for this immunotherapy, and which schedules I explained him and I told him. And after listening everything after 20 minutes, then he said, Doc, I'm not able to sit for a long time. I don't have a time. I can't come for the injections every time. I told him, why can't you come? Why don't you come here? Need not to come here. You can go to the family doctor. He will give you. No, sir, I can't go because you are asking me to wait for 20 minutes for injections. And before that, another 10 minutes, I had to wait for the doctor to prepare and give me injections. So the discussion went on for 1 hour with that particular patient, and he said finally he refused it. Then at the last minute, I told him there are some alternative routes are available. I will try. If I am successful, definitely I will call you and I will give you. And you have to give me 1 month time. So 15 days we tried and communicated to most of the people, and they could not give me correct answer. And a parthenium, we can't send the parthenium to those patients to those centers to prepare and give it back. So ultimately, it 3 weeks over, and the last week only 1 week left, and I am very curious that he will come back and he will ask me about it. And we made a small get together with the pharmacy people, and I explained everything about them, and ultimately they said it can be done. And the moment they said this can be done, then I was little comfortably breathing. And then I initiated next day itself, and I gave all the Parthenium allergen extracts, and they formed within 3 days. They could be able to formulate it and give me. And by end of the week, I said it is ready, and we will see whether that patient will come or not. So he came, and I told him, explained him what has things happened. He should be well known about all the things what has happened. So I explained all the things, and he agreed. Doc, I will take it. I don't have any reservations. I know you are all having a very good technical people, so definitely they will take care of my health. And he started taking the therapy, and I gave it for 2 months, 4 bottles. The same. Initially, we started with a build-up phase. Then we went to the maintenance phase. I told him, when you start taking about 6 drops to 7 drops in the 4th bottle, you have to come and report. So he came, and he was waiting in the waiting room, but I was little shaky what results he gives me. Whether he will be scolding me or he will appreciate me, I don't know. So he came. I kept quiet. I didn't talk to him. And I said, what has happened? Then he said, as per your schedule, I made it everything. Now my symptoms are very under control, and I'm very happy about this treatment, and I would like to continue. It was the time where really I was floating in the sky.
That was the best reward.
Yes, reward. And the patient reward is very, very essential, which is you can't replace with any other rewards.
Yes.
And the way in which we toiled, the way in which he expressed, really, I was a transformation of my life itself. The pain, how much we have taken from the struggling to establish and creating a new formula of our own. Nobody has given it, and we started it, and it was going. And later on, we learned what is the limitations and of the drops what we are using. So it took another 6 months. So we had our own formulation for slit diluents, and diluents, because the all parental, that is kit, is containing a more phenol. Phenol should not be given in the oral form. So that has been replaced. And other parameters we pharmacist did it. And that became a good formulation. And we started using the slit drops. And that is how the initiator started. And later on, when I started learning from the EIK Congress, the first Congress which I went after 2000, the same preliminary data which they are also getting from the Italy and from the European countries like London and other places. And a second visit when I went, and at that time, some improved version they started telling about the slit diluents. They were giving more importance to the slit diluent, and also they were giving the optimum dose, how much of the allergen quantity has to be introduced. Before that, this was only referred as a skit, and about 100% or 200% of the skit dose has to be increased to the pollen. That was the version. So that is how the version was going on. And I attended one of the breakfast meeting also on the slit. And so they were expressing that slit need not be given as a build-up phase. You can start with a maintenance dose itself, and it is much more effective and much more comfortable. And we used to have initially, when you give with a build-up phase in the higher dilutions, that used to give a lot of irritability, itching, irritation in the lips and the tongue and other things. And when I started giving the higher dose as a build-up phase, there was no side effects at all. And all the side effects was nil. So that means the tissue can tolerate with a higher dose rather than the lower dose. So that was the version. And subsequently, because storing is a problem. The liquid form, the diluents, storing in the fridge, at that time, the fridges was not available in the houses as what is available right now. And they used to keep in the medical shops. So medical shop, they used to have the refrigerators. On request, they used to keep them, and they used to take every day and going and coming back. And a lot of complaints was there with the patients. And also in the village, they don't have a refrigerator, and very difficult to keep it in the form. And we thought, why can't we have a solid form? Solid form can be stored at a room temperature, cool place. So then that is how the strip was started. So alternatively, strip is the only answer. And we took a long time to make a final formulation for the strip. And then we could able to succeed, and we introduced this strip. And later, we have a tablet form. And so tablet form also is a compressed tablet, which is not a lyophilized tablet. So that also was giving a good result. So that's how we started with the compressed tablets. So that's how the slit has continued.
Yes, and now everyone understood that there are lot many problems with regarding storage while traveling. So many are shifting into tablet forms now, and now we know that one international company also came with the slit tablets.
Right.
But sir, now we know key system level gaps are there about the approval. So as we know, key DGCI still not have approved immunotherapy sublingual form. But sir, your experience, because you have got approval from the Karnataka Drug Society.
This is a small brief I'll give you about this introduction. So NBI is one institute in Noida, which is closely associated with the CDSU. And so the drug controller doesn't know anything about the allergens, allergen extracts. And they were asking, what is this? What is that? And so many things. So we had a couple of meetings every month. We used to meet, and we used to call the drug controller. One or two participants were there. And we had good interactions. And within a few weeks, and they could able to understand. And in the meantime, we had one representative from the Indian Pharmacopoeia group. So we used to have interactions with them and told them that the Remington Pharmacopoeia, they already introduced these allergen extracts. So it is a high time that it should be introduced into a national pharmacopoeia. And he said he has done it, and he introduced in 2017. We started this meeting in way by 2015 or 16. We started, and Dr. Agarwal was there, Dr. S.N. Gaur was there, and Dr. Naveen Arora was there, and other couple of people were also there from the NBI. And we had explained everything, and we told them what is kit is available, and you already licensed for this. That also they don't know. They have licensed for a parenteral, and they don't know what is a allergen. So they have licensed as a injectables. And so I told him this from injectables to oral forms we are introducing, and this one of the allergens is house dust mite, which is predominantly done in the practice. And Dr. Vikar Sheikh from Mumbai also, he was one of the member. He was also raising his voice that slit is working very well and it should be used in India and it should be given a approval. The existing chief drug controller was one of the chairman for our meeting also. For a couple of times he came there, and he also promised that he has understood about the allergen concept and he has agreed and he will do it. And he has final conclusion was done, and he said that he will be approving and he will be doing. But I don't know what has happened. There was some problem with the NIB and the CDSO, and it was stuck there. And even we are talking to them over the phone and telling them, yes, yes, we will do it, we will do it to solve, they were telling. And in the meantime, we had one thought, why can't we approach our local drug controller who is in charge for the state? For example, for Maharashtra drug controller will be in charge. He is the man who is responsible for giving a license to the manufacturers. Similarly, in Karnataka, we have one. CDSO people, they are not issuing any licenses. They are controlling these state drug controllers. So we went to the drug controller and we told them what is explained them what we are doing and what we are getting it. And so that gentleman was very, very cordial, and he was very academician also. And we explained him, and he said, okay, I want to come and see your place. Then he came one day and he said, and immediately said, we will give you the license. You go ahead. So there are two licensors. One is Schedule K and Schedule N. In there, the Schedule N, as a doctor, you can dispense and you can do until the label. You have to give the name of the patient and what for this, the contents, and you have to give the version, what for it is used. For example, I think in the older times, the doctors used to have the pharmacy and they used to give a cough syrup or a constipation syrup or a diarrhea syrup or something like that. So similarly, they said, on those class, we are giving you this, and you have to dispense, you have to make your own formulation, and you can give to the patient. It should be named patient prescription. That is personalized medicine. So we told them that as per the schedule, whatever you feel that we had to do it, definitely we will make it and we will follow it, and we need your guidelines also. He has agreed on that, and we started it. That's how we started with the license. Because some people were asking whether is you have given this drug, whether it's approved by drug or not. So for that basis, we thought we should go to the drug controller and take a drug license, and then we started it. But it's not Schedule M. Schedule M comes under the manufacturing unit. We are not manufacturing. We are preparing and giving to the patient as an individual patient under the name of his particular patient. So for that, he has agreed and he has given. On that basis, later on, I came to know this particular version was nobody has given and is the only one center endorsed.
Yes, sir. Yes, sir. And I think our mentor, Professor Major K. Nagaraju, sir, he was also one of the person who fought for the license to get approved slate. Yes. So now, sir, you are running a course on allergy course training program in India.
Yes, sir.
So what core skills or mindset should young doctors who are interested in allergy, and as allergy is increasing, the interest in the field is also increasing among doctors. So if
Yes,
they
sir.
want to pursue a course for allergy, what core skills or mindset they should develop?
You see, this is a scope, the training program what we had basically with the workshops. And I used to go to the Patel Chest workshops and other workshops, and we used to have a pre-conference workshops, 1 day workshop. And we used to speak them, we used to teach them, and everything we do it. And the 5 days, 15 days workshop were done in the Patel Institute. And anybody who participates, not a committed people, so they learn and they go back and they can't able to practice. The reason behind is they can't implement it. Implementation is until unless you understand what is the subject, how to do it, how to convert into practice, and how it should be practiced. So all these parameters which is not possible with the workshops. That's what I learned. And later on, I thought we should have a lengthy workshops. It should be repeatedly, they should work in the practice, and only they can do it. So one fine day, I went to the Bangalore Rajiv Gandhi Health University, and I spoke to the Vice Chancellor. He happens to be the dermatologist. I know him from a couple of years, and he listened to it and he said, okay, we will discuss in the Senate, and if Senate approves, definitely we will make it. So we made the formalities and everything is given. And it was went to the Senate, and there was a voting on the Senate. I didn't know who are the Senate members. I didn't approach any of the Senate members. And the moment they put the name Bangalore Allergy Center and the name of fellowship program in allergy and applied immunology, and the voting was unanimously selected. I was surprised how it was done. And they said that your activities is already known to the people and they have already agreed for it. And that's how this fellowship program. And they said that yearly you can take 4 candidates and you can train them. But they have put a condition that it should be post MD. So MD people who are completed in the specialties and medicine, pediatrics or pulmonology and skin and ENT, MSc in ENT. So this is a condition they said, fine, we will do it. So that's how the terminology has started. And we had a syllabus which formed ourselves because the subject is new to the people. They can't able to nurture it. So we made it our own, our team of our own people. So we sat together and we said, these are the things has to be stipulated. And we started it and it was going well.
Yes, sir.
So
So
here we learned that they had to attend the clinic and see the patients and understand how things going on. Just doing a skin prick test will not help you to become a allergy specialist. You have to understand after knowing the allergy molecule which is positive and how it is, where it is, and these things parameters they had to study, and the volume which they had to prescribe for immunotherapy. All these standards are set, and we learned that with this fellowship they are able to practice.
yes,
Earlier, it was not possible with the workshops.
yes. So they become more dedicated towards the field of allergy after attending the
Yes.
fellowship program. Yes, sir. So now, exciting journeys are in your past and present. We are witnessing that. So something about future, sir. So what's your dream? Now we know allergy has a way long to go. What's your dream scenario for allergy care in our country by 2030? Maybe after 5 years, where we will be?
You see, the scenario of allergy progressing from 1980 in my practice. So at that time, the inhaler was only the salbutamol inhaler. Before that, Brovan was there. Replacing the Brovan to Australian was there. And it was a SOS drug. Then they combined with budesonide, and beclomethasone was given. That is called Beclate, and it was a short acting. And we thought that that gives a better relief. And subsequently, budesonide introduced. And you know that Astra people has introduced this Palmi card. It was a small canister. It was costing about 100 rupees. And people were familiar, very happy that 100 rupees canister will last for 1 month. I'm totally free from all the symptoms. That was the version which they started it. And we thought, so this immunotherapy has no role, so they are getting better relief. I think we had to take an alternative route of practice what is to be done. And after 6 months to 9 months, we came to know that Pulmicard will not be sufficient. They have to increase the dose. Even increasing dose, symptoms are not under total control. So there's the version which has started. And similarly, other molecules have come differently and different combinations, but still immunotherapy happens to continue with that version. And now the biologicals has come into the force, and we thought biologicals, Xolair will take care of the allergy, so immunotherapy may not be role. And we came to know that limitations of Xolair, and that is also has limitations. And other new molecules has come into the market, and all are passive immunotherapy. They are not. They are reducing the molecules. They are not producing any molecules. And whereas in immunotherapy, it stimulates and produces more of molecules. So we wanted IgG replacing the IgE. But they are removing the IgE molecules, they are removing the eosinophils and seeing that they are comfortable. So for those patients who are dependent on the steroid and repeated demand for hospital admission and ICU, then yes, it is required for them, not for the regular application. So that's how we are more confident in this immunotherapy. And also we understood that after introduction of sleep immunotherapy, we also have a number of understanding how the allergens has to penetrate into the systemic circulation, how it has to be done. So we are trying with the adjuvants, we are trying with the vitamin D, B12, we are trying with the pre-probiotics. They're all giving very good support. And now recently we have thought of just a few days back, we had a discussion, liposomes. So liposomes also carry the allergen molecules, transport across the mucous membrane, and it stimulates the cells. So these are all things are going on. I think we are also growing. So I think we are not 100%, but we are better than the previous era. And we are almost 60 to 70% successful.
As I understand, with advent of many new molecules, but still the role of immunotherapy cannot be challenged. And
Yes,
immunotherapy also will be getting finer and finer. We will be getting many good immunotherapy products too. And
exactly.
sir, you are member of many allergy societies, and we have many organizations who are working. Like we have ICAI, we have IP Allergy chapter. So, what role do you see these organizations will play in future in developing the field of allergy?
Yes, sir. Now, in India, we had to develop a course on this particular allergy field, either DNB, which is the best method which we thought. And earlier, the Indian Medical Council at that time, they approved for the diploma course in allergy and immunology, but no college has taken the initiative, so they could not continue and they have discontinued. Now the diploma has been winded off. And only alternative we have with the DNB people. So DNB National Board, which they can initiate and already initiated. So the work is going on. So probably with a couple of few months or a year, we could able to get approval from the DNB on allergy and immunology. That will be a better option so that people can initiate the allergy. And the allergy field is little tough to understand, and dedication is very much needed. So just like people understand that if I am master with this SPT, I can do allergy practice. That is not so, and very difficult also.
Yes, sir. So definitely. And good news is that one of our friend at AIMS Kolkata, he has
Uh,
started with a full-time 2-year allergy course. That is
uh,
postgraduate diploma in allergy. He has
oh,
started. and hope MCA will start recognizing allergy degree as a degree in our country.
Yes,
So
sir.
moving on to few rapid fire questions, sir.
Yes, sir.
So one word or one sentence answer from your side, sir. A myth about allergies you'd like to bust.
Okay, sir. You said the allergies are just childhood problem, right? And kids outgrow them. So the reality is some children may outgrow food allergies or eczema and many allergic conditions like rhinitis, asthma, or even food allergies, which outgrow after a certain age. The mechanism which we don't know, it happens. But some cases, it persists even in the adulthood and different allergic expressions are happen and different target organs are affected and we call it as atopic march. And so anybody who is having eczema in the childhood may evolve into this particular pattern. So why it matters, we have to understand. And so the diagnosis of this particular event, it has to be understood in the beginning itself and initiate the treatment appropriately. And even the dermatologist could not able to diagnose the atopic dermatitis in the early stage. And they start treating with the explaining as eczema, sometimes with different forms of eczema. And if they initiate the right treatment in the beginning itself, definitely this allergy march can be deviated. So one should be very clear about this concept and how this allergy march happens, how this can be modified.
Yes, sir. Thank you, sir. A big statement. Many myth is definitely there. They outgrow and they don't seek treatment at the right time. So
Correct.
my next question is one allergy tool or test you absolutely trust in allergy.
You see, this is based on the IgE mediated disorders. That is what we are focusing on more. And we should encourage to study and research more on the IgE molecules, which is relevant to the environmental health, air allergens and food allergy epidemiology. I think ICI and API should shape the practice, giving a proper guidelines, and you should be promote the academic institutions and how this can be. I think we have to open more of OPDs, allergy clinics in most of the colleges. If it happens, automatically the people who are working on that allergy, definitely they will take it up the initiative and they will start. And definitely they will be impressive with the postgraduate courses in allergy and immunology.
Yes, sir. Hope the day is not far away. We will be having allergy clinic
Yeah.
at every hospital and college. So your favorite journal or scientific journal or go-to resource for us, would you like to recommend?
The You're asking about the journals, right?
Yes.
Yes.
Your favorite scientific journal where you get most of the latest information in the field
Yeah.
of allergy.
I am following more with the EACI, allergy and pediatric clinical application, clinical experimental immunology. These are the three journals which has been published from EACI. They are really good. They are giving the latest information and their the the inputs which is really giving a better outcome. And also American Academy of Allergy Immunology, they are also publishing and they are good. I think following reading these journals and taking up the output of these public data, definitely we can implement a simple thing we can take and we can implement. We are not R&D organizations or centers. Our main objective is to give a total relief to the patient with a simple formula. So if that is possible, definitely we can take it. For example, the milk allergy. So there is a formulation called complete hydrolyzed formulation, which may be expensive. So we can see this milk by boiling what are the molecules are available, whether the patient can accept the boiled milk or a unboiled milk. So like this, there are some few clinical tips we can pick up from the field and we can apply. That will be a better option.
Question. We know you are one of the best allergists in our country. So, one allergist you admire in India?
It is very difficult, sir. Everybody has got their own top priorities and they have got their own aims in doing this particular project. And what I have seen in my practice and my life, Dr. D.N. Shivpuri is one of the best. And he used to have interactive sessions in every conference. And he, up to the age of his own normal life, he contributed a lot of things. Though at that time the allergy was not evolved, but still his thoughts was really provoking. And because of Dr. D.N. Shivpuri, he appointed the Dr. A.B. Singh and M.K. Agarwal, and both were doing very good job. A.B. Singh has done the aerology work, and he has done a very good job, and he has taken the central government projects, and he has surveyed the most of the different centers, which is very difficult, and he could succeed. And he has given a lot of information, like making a pollen calendar, and the importance of the pollens in the particular states, because we have got a different fauna and different pollens, north to south, east to west, all different pollens which he has compiled and is published with the ICMR project. And he has done a very good motivation as a secretary of the Indian College of Allergy and Applied Immunology. So still is active. Even he has crossed more than 76 years, still is active and is continuing. And really, hats off. And recently we missed Dr. M.K. Agarwal. He also is dedicating to this field, and he has done more on the immuno characters of the allergens, and also he has done more work on the insects like mosquitoes, cockroach, and a moth. So he has done a very good work on these allergen extracts. And though he had some setbacks in the global, but he continued to have it. And other few, what I can suggest is some are living. For example, Dr. Akashe, he was doing a more work on the aerobiology, and he was the first man to publish the pollen calendar in the newspapers. Every year, every week, he used to give the pollen load of Bangalore and publish in the paper Times of India. Now, Dr. Rajkumar has started this work, but he is displaying the in front of his institute about the pollen counts, like what we have the pollution board. So he is organizing the pollen counts. So like this, if the people are get involved, a small things which is more informative to the patient, which is very, very vital role, and it has to be initiated. And Yaki, just a few years back, there was one gentleman like aerobiologist, he has done one tower. So he has installed the tower in the particular place, and it gives the pollen counts by itself. It identifies by itself, and it displays the so much of count with the particular pollens like this. So like this, we can start doing it. Maybe much more we can hear from our country also.
Inspirational, sir. We are lucky to have all of them in our country. So, a philosophical question: a book, quote, or philosophy that guides your practice, your rational practice.
What I should speak about it.
See, your own philosophy, you can say, about practice that will guide young allergists in our country to practice rationally.
Ultimately, the summary of our existence with the practice of allergy is to give a total relief from the allergy, not only giving a total allergy symptoms, and they should have the free from the pharmacotherapy drugs. And then only you will give the total quality of life. So in my series of my practice, I have seen patients who are giving a total relief to the patient and total relief from the drugs, and they are very comfortable and they are very cooperative. And that means their adherence to the treatment is very, very important. And we have to motivate them. So motivation is very, very crucial. Whatever the tools you have, until unless you talk to them and see that they also embrace the therapy and stick to the schedules, and the response will be more and it will give a better results. And the youngsters, what I am telling them, the understanding with the present generation, they want a quick action, quick results, and everything should be quick and short, which is not possible in allergy field. And a people who has got a patience and dedication, spending a lot of time with the patients, because history is very, very important, and they have to work with the history. History alone give a more clues about what type of allergy patient is suffering, and it can be confirmed with the skin prick test. And again, we can confirm with the skin prick test. After that, we are doing a nasal provocation test. Nasal provocation test after introduction, we are very happy about it. Just to share about it, NPT. So after doing the skin prick test, before that we do the specific IG test, we get a number of 10 to 15 allergens, very positive, very high sensitive. After that, we will do the skin prick test. And after that 15, we may be average about 6 to 8 allergens we'll be getting. After 6 to 8, then we do the nasal provocation test, NPT. Only 3 or 4 allergens are showing positive. Out of that, we can score it. Minimum 2 allergens we can include. So that 2 allergens to come to arrive, these 3 test procedures are very important, and the therapeutic efficacy will be much better when compared to the 4 allergens or 6 allergens in immunotherapy. So I suggest everybody should learn the NPT, and they should monitor, and they could adopt in the day-to-day practice, and they can do wonders in immunotherapy. So if they are successful, we are also strengthening our specialties.
Definitely, sir. We'll definitely would love to learn nasal provocation test from you, because we have limited resources in our country regarding the allergens to be used for nasal provocation test. That will be some different episode we'll have, sir, some academic
Very
session.
good, sir. Very
And
good.
from today's interview, definitely it was very inspirational and motivational for me also. And before we sign off, sir, your one line or one message for all the young allergists in our country, or a wish for the future of allergy care in our country.
The commitment from your side and commitment for the patients, these two amalgamates, and the success will be there. So to convert yourself as a commitment, you should understand how the allergy has to be treated and diagnosed. And if you are appropriate, then you are a better mature man. Ultimately, you have to make the patient also to convert into adherence properly, how the treatment has to be taken. And this has to be done only by counseling. You have to spend a lot of the time with the counseling, and definitely they will give the message. And that's why the allergy practice is not very successful, because they feel it that just by immunotherapy everything will be all right. Giving a prescription with the immunotherapy and giving injections will not work. You have to make them to convince and move together. And if you married with every patient and go with it, definitely your answers will be there. I hope everybody can understand before coming to the practice of this allergy. That's why the people are not coming to the practice, because it has to be toiled with a lot of time and struggling. But once the people who are come to the practice and struggled and got a rewarded, they will never close the allergy practice. They will continue to have it. And the people who can't understand and they fail to give a deliverance to the patient, then they will, no, sir, allergy doesn't work. So these are the conclusions which they make. That means they are not understood, they are not implemented. That's why they are not able to do it. With all these things, still we are not able to convince our own colleagues in a specialties like medicine, pediatric, and pulmonology, ENT. Everybody now ENT people are coming to the allergy because they are already saturated. They don't have a provision for going for the surgical procedures. So they want to do this either vertigo or the allergy. They feel it. Allergy is very simple. They can, once they come to the allergy, then they will understand how tough it is. So
Yes.
it is multidisciplinary and they have to understand. And once they understand, it becomes very easy. They can do it very simple and very comfortably they can do it. So only thing they have to participate in the workshop. They have to come for the conferences. They have to learn the new things and it becomes very easy. And I have seen that from my practice, and people who are dedicatedly coming to every conference and participating with the interactive sessions, and they are very successful. So this is a final message to
Yeah,
the.
thank you, sir, for those golden words and lines. So, friends, this is Dr. KV Nagendra Prasad sir's journey. Thank you, sir, for sharing your wisdom and journey. And friends, stay tuned. We will be having one more Legions in our next episode. Thank you very much. Thank you, sir.
Thank you very much, sir. Thank you.
Thank you. Thank you.
Bye.
Bye, sir. Bye, sir. Thank you for taking out your time, sir.